53-year-old Shemez Kanji was living his normal life in Boston, Massachusetts, with his wife and 2 sons. He felt fine until a recent routine annual checkup. His doctor gave him a PSA blood test. This determined he had 10 times the amount of PSA in his blood than he should have had. A follow-up biopsy revealed cancer in his prostate. He now has an appointment to remove his prostate in January. Have you ever felt something odd or painful in your body and ignored it because you were busy or thought it was nothing? Well, many of us have, and yet modern medicine, especially in Canada, offers a wide variety of free screenings that can identify problems before they become serious. So why don't we talk to our doctors? Why not? Over the past year, my family has been involved with the medical system a lot. This has really impacted how I see preventative medical care. Of course, this wouldn't have helped my mother, whose aneurysm was too uncommon of a condition to screen for. But it does make you think about what if it could have been identified earlier on, before it ruptured. Today, I'm going to argue that all Canadians should go in for screenings according to a widely promoted national schedule. This would cost Canadians just a little of their time, but it would greatly reduce mortality rates. Today, most medical screenings are based on voluntary presentation by the citizen. However, it's well known that many people avoid the medical system. For instance, in the United States, reasons for avoiding screenings include 33% simply don't trust the medical system, 4% expect to improve without treatment, 16% have time constraints, 12% believe they're completely healthy and so require no screenings, and 50% are concerned about the cost. But even in Canada, where medical care, including screenings, are free, 68% of the population have skipped seeing their doctor even when they knew they should have, and 4.8 million people, approximately 13% of the population, don't even have family doctors, so they definitely don't seek regular screenings. It's unfortunate that even those who know that they have symptoms of a possibly serious condition don't even go to talk to their doctor. Why? Because screenings save lives. Screenings are the best way to find medical conditions at the stage when their treatment is most effective and least expensive. They also reveal risk factors that could be causes of other conditions. The American Cancer Society states that early detection of diseases could help prevent or find half of new cancer cases. And the Canadian Institute for Health Information reports that early detection of serious illnesses could save Canada 9 to 20% of their $264 billion healthcare budget. Some might argue that screenings are too expensive and ineffective. There are thousands of medical conditions out there, most of which affect such small numbers of people that screening everyone would be very expensive. Some screenings, while affordable, do not yield any improvements in health outcomes, but both kinds of screenings do still supply doctors and citizens with information. Although not all screenings are affordable across the entire population, the following screening tests are available, beneficial, and cost-effective: breast, cervical, colorectal, and prostate cancer, diabetes, osteoporosis, and heart disease. Though screenings are readily available for these conditions today, people cannot be trusted to voluntarily present themselves to a doctor. Some organizations, recognizing this problem, promote certain screenings during certain times of the year. For example, October is Breast Cancer Awareness Month. November, called Movember, is a time when prostate cancer screenings are promoted. February is Heart Month. And confusing matters, November is also Diabetes Awareness Month. Since cancer, heart disease, and diabetes can all occur and be detected at any time of the year, I see no reason why these screenings should be promoted during particular months and then ignored for the rest of the year. Rather than occasional promotions to encourage occasional screenings, I propose a national guide similar to the Canada Food Guide that would inform citizens about medically beneficial and cost-effective conditions and screenings. This national guide will be promoted continuously throughout the entire year by all levels of government, with the goal of making sure that nearly all Canadians are treated for all conditions common to their age group. In that way, the medical system will deliver the greatest possible benefits to Canadians. Shimez Kanji is hopeful that early detection of his prostate cancer means that the cancer is not spread to other parts of his body, and that after his surgery, he can look forward to a full recovery. He wants to see his sons graduate from university. He encourages all of his male friends to go in for the same blood test he had. A national screening guide could make a huge difference in the lives of Canadians across the country. Why not try it? Thank you.